Well, good afternoon, everyone, and thank you for coming this afternoon. My name is Dr. Kathy Lofi. I am the State Health Officer and the Chief Science Officer here at the Washington State Department of Health. Over the past week, there's been a lot of news about the spread of COVID-19 in countries outside of China. And in addition, we heard yesterday about a person from California who was diagnosed with COVID-19 and had not traveled, which suggests the person may have acquired the disease in their community. Given the rapid evolution of this situation, we thought now was a good time to give you all an update on some of the work that is currently underway here in Washington. So first of all, the public health system in Washington continues to do everything we can to quickly identify people with COVID-19 here in Washington and to prevent its spread. So we call this phase of the response the containment phase, and we're working hard to keep the virus out of Washington and to keep the virus from spreading here. We have requested that healthcare providers ask patients with a fever or respiratory symptoms whether they have recently traveled. And if we identify a person who is sick, who may be at risk for COVID-19, we immediately separate them from others and get them tested. We also continue to reach out to people traveling from China to Washington to tell them to stay home and home from work and home from school for 14 days after they return. Today I do have some good news to report. We are about to start testing for COVID-19 here in Washington, right here in our state public health laboratory. And this will allow us to more quickly test individuals with fever or respiratory symptoms who may be at risk for COVID-19. So as of today, there isn't good evidence of ongoing person-to-person transmission here in the United States, which means we still consider the risk of COVID-19 to the general public to be low. But given that the virus is now spreading in several countries, we do believe it's very likely that we will see spread of the virus here in Washington at some time in the future. If the virus starts spreading in Washington, we might consider implementing certain measures to keep people away from each other and to slow the spread of the virus. So these include measures like closing schools, canceling large public events, and encouraging employers to let their employees work from home. We're also working with our partners in the healthcare system to help them plan to potentially provide services to more patients than usual. Last week, Secretary Wiesman reached out to hospital, healthcare system, and health plan executives and asked them to review their plans to expand their ability to see more patients than usual and to assess their supplies of personal protective equipment. I realize that these planning efforts, may be concerning to some people, but there's really no need to panic. We're still not seeing a significant spread here in the United States, and we're learning more and more about the virus every day. So what is important for people to do is it's important for people to stay informed about the situation, and we encourage people to get their information from credible sources like the CDC website or the Department of Health website. It's also important for people to practice good personal health habits, like washing your hands often with soap and water, staying home when you're sick, and covering your coughs and sneezes with a tissue, throwing out the tissue, and washing your hands afterwards. So in addition, people should also start to think about plans for what they might do if their child's school closes, and should check in with their work about their sick leave and telework options should they need to stay home to care for someone in the future. And with that, I would like to open it up for questions anyone might have.
When is it that we'll be able to test for the disease in Washington? What day specifically?
Yes, do you want to answer that?
And I'm Scott Lindquist. I'm the state epidemiologist for communicable disease. So we got the test, we validated it, and starting tomorrow morning, we'll start testing the first samples coming in.
And where are those samples coming
Well, they come from any provider around the state who says, hey, look, I've got this person who's traveled and meets the criteria that the CDC gives us to allow us to use the test during, because it's an emergency authorization use. Has to fit these criteria, and it's pretty clear these are people with fever, cough, and have had traveled to any of the affected countries. So docs will call us or the local health departments and tell us about a patient that's under investigation, and then we make arrangements for that sample to get here. And then we'll do 2 runs a day, and we'll work 6 days a week.
And will it still take 7 days, is it, in order to
No.
get the, no?
The goal is if it's in here in the morning, mid-morning, we'll have a result by 5 o'clock that afternoon.
And that's quicker than what we have now.
Oh, it's a lot quicker.
So are there tests that actually will be run tomorrow? There are people currently who fit that same criteria?
There are. This coincides with an expansion of who the test is allowing to screen for because of the other countries where there's ongoing transmission. So not only do I think we'll see an increase in volume, but with a faster turnaround, I think we can get to these results a lot faster.
Is this happening in other states, or are we one of the only states that are maybe doing our individual testing?
No, every state was offered this at the public health lab. I can't speak for other states, but we're probably one of the first right out of the gate to get going.
It's a battery of questions from other reporters who are working on coronavirus stories today. I wanted to follow up on some school questions. Are you guys advising school districts on how to prepare for this and how to respond?
So I can answer
Yeah,
that.
go for it.
Yes, and in fact, we had a large conference call with our schools, all the schools, school districts in the state on Tuesday afternoon. And we do have a document on our website that has guidance that's specific to schools. And we did, talk to our schools a little bit on Tuesday about, the potential for needing to close schools. Should we start seeing spread? Because we want, schools to be prepared to, should we start to see spread here in Washington?
Can you talk about those guidelines at all?
Sure. So the guidelines are really sort of pretty basic. Currently, we are not really recommending that schools do anything that's really much different than what they do every day. Because there are a lot of recommendations that we have in place every respiratory season for schools so that they can decrease the spread of all viral respiratory illnesses in school settings. So it's a lot of the same messages that we're giving to the public: wash hands. If hand washing is not available, use an alcohol-based hand sanitizer. There is some guidance in the there's a section of the guidance that's all about environmental cleaning, cleaning of frequently touched surfaces in schools once a day, which is what we normally recommend to schools during viral respiratory season.
And can you talk about the setup at Maple Lane at all?
Yeah, well, currently that's in process. It's really not in place right now, and the goal is very similar to what we have here. Have a space, a safe space where someone can be quarantined, and quarantine means you've been exposed to the disease but you don't have symptoms, where you can be for 14 days while we make sure that you don't develop symptoms. And so that same thought is to be at Maple Lane. In addition, if one of those people, say we're quarantining them, they develop symptoms, we would obviously test them, but we'd have to have them in an isolation facility because they would be symptomatic and we don't want them to expose other people. The beauty of this is we now have the test, so this is only going to be about a day before we can figure out whether you can come out of isolation because your test is negative.
Any safeguards for folks working at Maple Lane or neighbors in the area?
Well, the space itself really minimizes any risk to anybody that works there or is even near the neighborhood. It's a pretty rural area. I don't know if you're familiar with the spot, but yeah. I have been involved there when we were doing Ebola considerations, where we would put an Ebola patient, and I've been there quite a bit, and I feel pretty safe about having it at that space.
And just to be clear, if they were confirmed positive, where would they be moved to? One of these hospitals, possibly Spokane?
Right, and so really dependent on how ill the person is. The first thing we would do if they were positive would be to move them to a hospital that was prepared to be able to evaluate them, meaning could put on a mask, the PPE, or personal protective equipment, do a full evaluation and determine, does this person need to remain in the hospital, or can this person be monitored someplace else, either at Maple Lane or at home or other places. So yes, not every hospital is going to be able to provide that level of protection for their staff. So we have a few hospitals around the state that are willing to do that and able to do it.
Now, as far as that issue of protection, I know at some stores they're out of masks. Hospitals have said they're really keeping a close eye on their inventory and kind of rationing out some of their inventory. What is your recommendation for people? I've heard several times that the CDC is not recommending the use of masks as a method of protection, but it seems like people aren't really listening to that.
Yeah.
So what is your recommendation?
Yeah, to be honest, I think about this personally for myself and for my family, and I have not rushed out to buy masks for myself because I understand the biggest need for those masks are the people evaluating folks with coronavirus or potential coronavirus. So that's really been our theme here at DOH also, is to make sure we're using those masks where they're most needed, kind of conserving the use and not seeing a lot of transmission in our community or even evidence of disease in our community. We would not recommend, and believe me, I understand the concern that you want to rush out and buy a mask, but I personally am not doing that. I'm encouraging all my family not to do that. And even here at DOH, we're encouraging the supply to go to the hospitals where people are doing the work of evaluation.
You mentioned that we're in the containment phase right now and that there's not evidence that the disease is circulating. What are you looking for right now that might trigger or be an indication that now it's time for a higher level of response? What sort of factors are you looking out for?
Yeah, so I can start and Scott can add anything you have. One thing that we do look for is somebody who would have COVID-19 here who would not have a travel linkage. And CDC is now recommending, just for the last few days that people who are hospitalized in the U.S. with severe illness who do not have another cause for their illness be tested for COVID-19. So that we can possibly, detect those individuals. We are also, making plans to start doing additional testing in people who have not traveled. And then we have a lot of systems that are in place that we use for influenza every year. We get data from our emergency departments and many urgent care facilities, and we can monitor the number of patients who are being seen for fever or respiratory illnesses. And that data can also indicate if there's a spike of in people coming in to the healthcare system with symptoms that might be consistent with COVID-19.
I'm sorry, can you talk more about that additional testing that you're looking to do?
Oh, yeah. Do you want to?
Yeah, so one of the questions is there some need for doing some surveillance in the community of people that aren't people under investigation? So certainly King County and Washington State are looking at the possibility of doing that. There's nothing being done right now. But also when our case was here in Snohomish County, we sent out a CDC team to swab those folks around them in the community to see was there transmission that's unrecognized, even though we had the person in the hospital in isolation and all those tests were negative. So we have no inkling, like Dr. Lofi has said, that there is transmission in the community, but we're opening up to these other thoughts. Probably the biggest thing is testing tomorrow with an expanded group of people that will do. So for example, if someone comes in, even though they haven't traveled, but they have an unexplained respiratory illness, the health officer from every county can call us, and within that day, if they get it here, we can have a result for them. So we'll start to see, is there transmission in the community that way also.
So it's people with an unexplained respiratory illness who haven't traveled. Who else might be eligible now for testing?
If there was for example, if there was a cluster of folks that got admitted to the hospital for even vague respiratory symptoms, if there was a recognition of there were 3 people today that came in, none of them had travel, that would be another, we would investigate that cluster of disease.
So basic question about testing, it's done with a swab, and how many health workers are going to be dedicated to testing for coronavirus here at the labs?
Yeah, so you're right, this is done with swabs, and we're finding that it's really 2 swabs. It's one in the nasopharynx and it's one in the oral pharynx. If someone can bring up sputum, we would test that, but it's really going to be 2 specimens per person. And you're right, to safely do this for a healthcare worker, you would have to gown up with an N95 mask, a face shield, a gown, gloves, and then do the swab. So that is not a small undertaking. That takes quite a bit of PPE. And again, this is why we would really prioritize that N95 face mask for folks like that that are doing the tests on the front line. Ideally, if you are gowning up, someone should be watching you. So like Dr. Lofi would watch me put on an N95, the gown, the mask, and then watch me after I did the specimens to take it off in a safe way that I didn't infect myself.
You know, how many tests, is there a backlog or anything like that? How many tests does the state have on record now to have to test?
Okay, so it's a great question. We've tested over a dozen folks for sure, but that was through the CDC. We're currently at less than a dozen waiting to be tested tomorrow. So the volume is not big, but I think as we open the criteria for who we're going to test, as we're looking for other folks in the community, it's unknown. That's why we're going to start out running 2 rounds a day, working 6 days a week in the lab. We may have to go up from that. We may be overly providing. It's hard to tell right now.
2 rounds a day, does that mean 2 people?
No, that means 2 times we run a panel for 13 patients each round. So around 26 people a day we could test for with the current capacity.
So you could get rid of the backlog tomorrow.
Yeah, it will be gone tomorrow.
We have time for
Only
one more
26
question.
a day. Only 26 tests a day.
As we start, because we just validated the test, the first we're going to start with is 26 a day. Correct.
Can you talk a little bit more about paying for staffing or extra staffing as some of this was being conducted at medical centers? Is that, what's kind of the plan for that if more people are being brought in?
Yeah, so a lot of our healthcare system partners have plans for seeing a larger number of patients than usual. We call these medical surge plans. And these plans use a number of different strategies to try to increase the number of patients that can be seen. First of all, they could think about, putting patients in certain spaces in their hospital that they may not normally use. They definitely need to think about staffing. And how they can increase, their number of staff, and then we also think about like stuff in the health department in a healthcare system, and do they have enough stuff, to kind of take care of everybody? So there are a number of different strategies. It's really our healthcare system partners who are the experts around thinking about how they can see, more patients than usual if they have to. In fact, usually every flu season, a lot of our clinics and healthcare system in our hospitals need to kind of see more patients than usual because they have increased numbers of people with viral respiratory illnesses in their hospital.
Are there any patients in the backyard?
No patients in the backyard.
I have just one follow-up question. This is so remedial, but I just want you to clarify. If someone has COVID-19 and is not showing symptoms, can they spread that?
Yeah, it's a great question. We don't know 100%. We've really only known about this virus for a couple months. We have seen examples where people were asymptomatic and the consideration that they had exposed this to other people. But, ask me in about 3 months and I'll have a much better answer. I think all our planning and protection that we're using right now is assuming that can happen.
And that is the time we have today, folks. Thank you. Thank you, guys.
Thanks.
Thank you.
So, fine.